Hi, it's Michael here from Bayside Headache Clinic. Today I want to talk about menstrual migraine and how changes in hormone levels can trigger a migraine for some women and how we think the neck may be involved. So today I'll be talking about estrogen changes during the menstrual cycle, the link between estrogen and serotonin, why serotonin affects headaches, how a sensitised brainstem is the underlying cause of headache and migraine and menstrual migraine, and what Bayside Clinic can do to help you. So the orange line on the graph here represents estrogen level changes during your normal menstrual cycle. Day 1 of your cycle is the day menstruation or bleeding starts. This is the lowest your estrogen levels will be. From this point onwards, they slowly increase until they reach a peak at ovulation, only to rapidly fall again just after ovulation. Estrogen levels then slowly increase again, although not to the high levels experienced at ovulation, and then drop off rapidly just before menstruation starts. It's the fall in estrogen levels just before menstruation starts that explains why some women experience a headache or migraine around this time. It's also why some women have a mid-cycle headache or migraine, as the level drops at this time just after ovulation. Estrogen is necessary for the production of serotonin. As estrogen levels rise and fall, the levels of serotonin in the brain will rise and fall as well. Serotonin is a neurotransmitter and it's responsible for mood and feelings of calm. Low levels of serotonin are thought to contribute to depression, while higher levels help us to feel positive and happy with our place in the world. Too high a level and it can contribute to feelings of anxiety. It also has an effect on blood vessels within the brain. When serotonin levels rise, the blood vessels constrict, and when it drops, blood vessels will enlarge. One of the other roles of serotonin is to modulate activity in the brainstem. The serotonergic control system is located in the brainstem, and it works to influence how our body responds to stress, hormones, and environmental factors such as food and smells. As I mentioned earlier, the serotonin levels are monitored in the brainstem, and changes in serotonin levels can affect activity in the brainstem. It's also in the serotonergic control centre that hormone levels are monitored. And we know that changes in hormone levels, particularly estrogen, will change serotonin levels. Serotonin levels will also change the pressure of blood flows within the brain. Now, research in the last 20 years has shown that headaches and migraines come from the brainstem. In particular, an area of the brainstem called the trigeminocervical nucleus. We currently know of 5 main inputs into the trigeminocervical nucleus. These 5 inputs are information from the upper 3 levels of the neck, including information from the occipital nerve, information from the trigeminal nerve from the face, the jaw, the sinuses and the teeth. Blood vessel flows from within the brain is also monitored in this area, and the serotonergic system monitors hormone levels and serotonin levels. There's also a diffuse noxious pathway, and this pathway helps us to control our perception of pain. So what we suspect is happening with menstrual migraine is that the serotonin changes and hormone changes are feeding information into the trigeminocervical nucleus area of the brainstem. And this, along with information from changes in blood flow within the brain due to changes in serotonin levels, push it over the edge, and it gives you a headache or migraine. So why does it happen in some women and not others? The answer is that some women have a brainstem that's already sensitised and it's overstimulated, which means it's primed to give you a headache or migraine before the extra information comes in and pushes it over the edge. Recent research by Watson and Drummond has proven that this central sensitisation can be caused by information from the upper 3 levels of the neck, which is feeding into the brainstem, and that the appropriate treatment can desensitise the trigeminocervical nucleus in the brainstem and make it less prone to producing headaches or migraines with hormonal changes. At Bayside Headache Clinic, we look for a common but really subtle dysfunction in the upper 3 levels of the neck. And that common and subtle dysfunction is constantly feeding information into the brainstem and making it primed to give you a headache or migraine. We find this dysfunction in the majority of cases, about 80% of people that we assess. We're then able to effectively treat the dysfunction, which allows the brainstem to calm down and return to its normal state. and we can eliminate or significantly reduce the headache or migraine of the vast majority of people, even in menstrual migraines. To book an appointment or for more information on our services, call 0423 071 971 or check out our website at baysideheadache.com.au. Thanks for your time.